health care for certain medical needs for the first time in weeks. Important procedures that have been long postponed. This is a critical change that will support the health of Maine people and provide a lifeline to rural hospitals and clinics on the brink of bankruptcy. This weekend, Maine people can also worship with members of their faith safely under new guidelines, and others may seek relief from the stress of these times with a round of golf. Today, businesses such as barbershops and hair salons can, with strict health and safety protocols, choose to open their doors to customers and staff once again. The new guidelines. And if they do not yet have the equipment or protocols they need, or simply do not feel safe reopening, they should not reopen, and they don't have to. And if you need a haircut, please make sure that your hairdresser or barbershop is complying with these guidelines. We want to keep you safe. These are important and meaningful first steps towards creating a new normal, a different way of doing business, shopping, traveling, and enjoying the Maine outdoors in ways that will keep us all safe. If we all pull together and follow the rules that are based on fact and science. We introduced these changes earlier, and there have been a lot of questions, and that's to be expected. We will keep working to answer those questions one by one and to address especially the needs of small businesses who are striving to survive in this new pandemic-driven economy. We've said from the beginning that our plan is a flexible document, that we are always open to constructive dialogue from all workers and businesses, lawmakers and members of the public, and that is still true. In the meantime, I know many of you are frustrated. Some say they're frustrated that the state is moving too slowly. They worry about the financial toll on summer tourism that is so vital to our state's brand and to our financial well-being. Some people say they want to go back to work, but they're afraid of having to deal with the public, including millions of people from out of state who usually come here every summer, many from Boston, New York, New Jersey, and other dangerous hotspots. And some are engaging in partisan political chatter over this pandemic. But we know that the virus plays no favorites. It doesn't care whether you're a Republican or a Democrat, a Green or an Independent, unregistered or unenrolled. It doesn't take political sides. It is an equal opportunity destroyer. Other people say they are frustrated that we're opening up any businesses at all because of so many people in our state who are older or who have underlying conditions or both, things that put them in the vulnerable category, putting their lives in grave danger whenever and however this virus spreads. They read the newspaper. They read that more than 3,500 people have died in Massachusetts from this painful virus. More than 18,000 New Yorkers lost their lives. More than 7,000 in New Jersey. 2,257 in Connecticut. And in just the last 24 hours, the state of Georgia has reported more than 1,000 new virus cases. I hear all of this. I hear all of you. With every order I've issued, every action I've taken, I have thought long and hard about how Maine people and Maine businesses will be impacted. These are some of the most difficult decisions any governor has ever had to make, in consultation, of course, with the people and the businesses affected, but always with the public health as our first priority. The challenges this dangerous pandemic poses to us and to our state are unlike anything we've ever seen in generations. And in threading the needles every day, in finding that delicate balance between saving lives and preserving livelihoods, I'm reminded sometimes of what H.L. Mencken said. He said, there is a single solution to every problem. It's simple, quick, and wrong. There is no simple solution here. No one size fits all. We cannot flip a switch and open up all the restaurants, all the bars, all the souvenir shops, and the motels across this state to do business as usual and risk an aggressive resurgence of this virus that will only sicken our people, destroy lives, and devastate our entire economy for years to come. I believe strongly that the vast majority of business owners across Maine, though they're frustrated about being closed and concerned about their future and having difficulty with the congressional benefits, I believe that they share an unflagging commitment to keeping Maine people healthy. I ask them all to stay the course, continue talking, continue listening, continue being part of the solution. And we cannot just remain closed. There are activities that we can do safely now that will allow our economy to begin to function again. I wish I could tell you all when this pandemic will be over, but I can't. If I gave you a simple, quick, and easy answer like that, it would be wrong. Because this pandemic and all of its impacts, it's extraordinarily complicated. So let me tell you what we are doing. First, unlike some states, we have from the beginning allowed construction, industrial manufacturing, fishing, home repair, pharmacy, auto repair, childcare, banks, laundromats, veterinary clinics, farming, and a number of other essential services to continue as usual with precautions. And we are collaborating with others from all economic sectors across the state to prepare them too to open as soon as they can and as safely as they can. I'm well aware that the current timetable puts a crimp in the ability of many businesses to rehire, to retool, and to take reservations from vacationers and others who want desperately to escape to our state in June, July, and August, to enjoy the beaches, the mountains, the lakes and rivers and fields of this wonderful place we call home. First and foremost, in order to expand business further and to prepare for the tourist season, we need more testing capacity. And we're working every day on that critical issue. Expanding testing will give us a better picture of how widespread the virus is now in our state and help us prepare in a measured and thoughtful way for an influx of people from out of state in the coming months. We are constantly reevaluating the plan we've put forward with input from all sources to adjust it and to safely restart our economy. And as we start this next stage, as we talk about reopening, there will be a lot of debate, and I welcome that. That's how the process should work. There will also be a lot of frustration, some winners and losers. I understand that too. And yes, there is anger, and I share that too. But let's keep talking. This virus is testing the limits of our patience, the limits of our economic stability, the limits of our state's health and endurance. In this, our 200th year, let us stand up to show the world who we are. Let's show them that no matter the challenge, no matter the difficulty, we will persevere. And let's keep talking. Our enemy is not anger or fear. Our foe is complacency. The people of Maine have proven in the last 6 weeks that they are courageous, patient, and compassionate. that they value the safety of our frontline workers and first responders, including the 253 brave healthcare workers who have been stricken with this virus. And the last thing any of us should want to do is to overwhelm the healthcare system and put these brave people more at risk or take their valuable lives. It is because of your actions, and uniquely because of your actions, that the virus has not destroyed us, that we have, so far, kept a measured lid on this insidious disease. Day before yesterday, 252 people died in one day alone in Massachusetts from this virus, a state only 15 miles from our border. I will do everything in my power to make sure that this deadly and untreatable virus does not hop a plane, a bus, a truck, or a train, or an SUV, or an RV, and land in our state and take over our state as it has taken hold in others. So let's work harder than ever in these next few months to keep this thing at bay and keep our people and our economy safe. We can do this because I believe in you, in the faith, ingenuity, and willpower of the people of Maine. I believe in our great state, and I will do everything I can to save it. I'm not a quitter. Maine people are not quitters. People are angry and frustrated, some losing patience. But no matter what, I will keep hearing you. I will keep listening to you, and we will listen to each other. We will work with each other. We'll do everything in our power to keep each other safe. We will not give up on each other, never quit each other, and I will never quit you. Now I am headed back to work for the people of Maine, and I will leave you in the good hands of Dr. Shah. Thank you, sir.
Thank you, Governor. Thank you very much, Governor Mills. Good afternoon, ladies and gentlemen. Thank the Governor for joining today. My name is Nirav Shah, and I'm the Director of the State of Maine Center for Disease Control and Prevention. Here today to provide an update on the public health side of the COVID-19 outbreak across the state. And we begin today, as we have on so many prior briefings, on a somber note. Maine CDC is reporting the passing of 2 additional individuals with COVID-19. One was a man in his 40s from Waldo County. The other was a woman in her 80s from Cumberland County. These 2 passings mark the 54th and 55th deaths, respectively and respectfully, of Maine people who have passed away with COVID-19. We continue to offer our deepest condolences to the families of these 2 individuals and all of those who have passed with COVID-19 during this time of their grief. Overall, Maine CDC is now reporting 1,123 cases of COVID-19 across the state, representing an increase of 28 cases since yesterday. Of those cases, 177 have been hospitalized at some point, an increase of 7 since yesterday. Right now in the state of Maine, there are 37 individuals in the hospital with COVID-19. 17 of them are in intensive care unit beds, and 20 are in non-intensive care beds. And 9 individuals are on ventilators. That's an increase of 1 since yesterday. Overall, 657 Maine people have recovered from their bout with COVID-19, an increase of 26. There are no new outbreaks to report today. There are, however, new cases to report that go along with those outbreaks. Indeed, of the 28 new cases, 8 of them are outbreak related. All of those 8 are related to outbreaks at long-term care facilities and other congregate living settings, and I'll get to those in a minute. As Governor Mills noted, there are now 253 healthcare workers across the state who have now been diagnosed with COVID-19. I wanted to, before we turn to the long-term care piece, go back to 2 points that we discussed yesterday. The first was a question that was raised about swabs that we are receiving on an ongoing basis starting May 4th and every week thereafter. And I can confirm today that some portion of those swabs will be coming from the Puritan manufacturing facility here in Maine and Guilford. That was a question that was raised yesterday, and we confirmed that, again, some fraction of those 15,000 of those swabs that we will be receiving on a weekly basis will be from Puritan. The second question that I wanted to clarify today is with respect to quarantine for individuals from other states who might be coming here. Our expectation and our anticipation is that any individual coming to Maine from another state arrive and be in a position to fully quarantine for 14 days. This means bringing with them all the provisions that they may need for that 14-day period. That's our expectation, and we hope it's one that is abided. I'd like to quickly provide an update on a number of the outbreaks that Maine CDC is tracking and working with colleagues across the state on. At the Augusta Center for Health and Rehabilitation, there are no new cases. At the Edgewood facility, similarly, there are no new cases. At Augusta Rehab, that number is 76. At Edgewood, the number is 14. At Falmouth by the Sea, there are 6 additional cases of COVID-19. At the Hope House facility in Bangor, there are the same number of cases as yesterday, 21. No new cases there. At the Maine Veterans Home in Scarborough, there are 2 additional cases, bringing the total to 53. At Tall Pines and the Cedars, there are both no new cases in either facility. 43 cases at Tall Pines and 15 cases at the Cedars. And at Tyson Foods, there are now a total of 11 cases affiliated with Tyson Foods. A quick update on Tyson Foods. We've been working very closely and collaboratively with Tyson Foods ever since the conditions constituting an outbreak were first identified. Tyson Foods is planning on following Maine CDC's recommendation to conduct universal testing across all the employees at the facility. They're also planning to idle the facility for a period in order to conduct deep cleaning. I'd like to provide next a quick update on our fulfillment of requests and orders of PPE. Today alone, there are 33 orders for PPE that will be delivered. Roughly 80% of those orders are going to congregate care settings, specifically to nursing homes. And the remaining 20% are going to first responders at the local level fire, EMS, and rescue agencies. Overall, and at present, I'd like to just quickly review the overall PPE inventory at Maine CDC. As of right now, we have on hand approximately 177,000 N95 masks, 92,000 surgical masks, approximately 12,000 face shields, about 1.1 million gloves, about 1,300 disposable protective suits, about 3,500 surgical gowns, and about 1,000 swabs on hand, nasal swabs. And as I've noted, we'll be getting a regular shipment of those swabs starting early next week. Overall, Maine CDC has now fulfilled about 1,350 orders for PPE across the state. And finally, in terms of the vital assets across the state, there are a total of 330 ICU beds, 171 of which are available. There are a total of 316 conventional ventilators, 290 of which are available. And overall, there are 397 conventional ventilators available across the state. Before I turn to our colleagues in the media for questions, I just wanted to share a quick observation. It strikes me that, and perhaps many of you have noticed, that things that were commonplace even 90 days ago, are almost completely unheard of today. Packed stadiums, crowded conference halls, bars packed to the gills. Those were scenes that were normal and a part of everyday life just a few months ago. And now, even to think back on those days causes many people to recoil with fear. Similarly, the opposite phenomenon has happened. The way that we live our lives today and the measures that people in Maine have undertaken with so much gusto would have seemed unfathomable 90 days ago, and yet here we are, and they seem almost obvious, so much so that they now seem in retrospect to have been inevitable. I mentioned yesterday that curves don't flatten themselves. Viruses just don't disappear. And epidemics just don't go away on their own. All of those things happen because each and every one of you has taken the steps that public health folks across the country and across the state have recommended. You are the ones that have made these fundamental changes in your lives, from going to stadiums and conference halls to bars, to staying home and helping to stop the spread of the virus. It's because of you that we've been successful thus far at flattening the curve. And I would again like to take a moment to thank everyone and acknowledge this fundamental shift in the lives that each and every one of us leads. And just please know that as you go about staying inside, as you go about heeding this call to inaction in some respects, please know that you are doing so for the sake of the greater good, but that your shared sacrifice is not one that is going unacknowledged. I'd like to take a moment right now to acknowledge that shared sacrifice and thank each and every one of you for helping us flatten the curve. So with that, I'd like to turn things over to our colleagues in the media. Today's first question goes to Alyssa Thurlow over at WABI.
Hi, Dr. Shaw. Thanks for taking the question. My first one is, do you have an update on the firefighter in Waldo County? And also, we got a question from a viewer about, when people are exercising outside, should we maintain distances much greater than 6 feet? I know there's some concern about risk associated with exercising, on busy streets, busy roads, or people may be driving by with car windows open, as the warmer weather arrives.
Great. Thanks, Alyssa. So Alyssa's first question involves the tragic passing of a firefighter in Waldo County. Our thoughts and prayers go to his family during this time of grief. Alyssa, what I can tell you right now is that our investigation is underway. We've made contact with many of those individuals that are involved from a public health perspective. Unfortunately, for reasons of privacy and to respect the family right now during this time of their grieving, I'm not able to comment anymore, but please know that we found this passing to be quite tragic, and we again offer our deepest condolences to the family of this individual during this difficult time. With respect to the question about outdoor exercise and whether a greater radius of 6 feet should be recommended, there is some suggestion out there that while you are outside exercising, more than 6 feet would be required. The US CDC has not made any official pronouncement about this. So what I would offer to everybody is as follows. When you're outside, especially when you're exercising, try to maintain as much distance as possible from the other people you're exercising with. Now, if you're going out for a jog with your roommate or your partner, you may not really want to be 20 or 30 feet away, in which case the 6 feet margin is acceptable. But if you're part of a running group, or certainly if you're out by yourself on a trail and you know that there are other people there, try to maintain as much distance as possible from other folks. In some cases, it might be 6 or 8 feet. In other settings, 20 or 30 feet might be possible. As much as you can maintain, the better. Thank you for that question, Alyssa. We will turn next to Michael Fern over at the Maine Edge.
Thank you, Dr. Shaw. I had a question for the governor, but I guess I'll ask both of you. There are reports across the country that some mental health centers and state CDCs are concerned that the ongoing lockdowns are causing mental health issues and suicides are likely to increase. I think a lot of this was reported yesterday, especially with teens who are more in need of socialization. Do you share that concern that the care might end up being worse than the virus for this age group? And are, in fact, suicides and mental health issues, in fact, rising across the state? And the other question has to do with businesses who are sending us questions. The most common theme we're hearing is most assume that this was going to be a 30-day pause to help flatten the curve according to both federal and state guidelines. Now businesses do feel that the goalposts have moved again, as it appears this is going to be a 5-month stretch. With Maine experiencing a lower mortality rate than other states that are opening up sooner, how is there still justification to keep these businesses locked down for so long?
Sure.
Thank you.
Thanks, Michael. So your first question involves mental health. You framed it in a way that I want to be very clear about. You asked if I thought that the cure is worse than the disease, and I don't buy into that characterization. There are tens of thousands of people across the United States, over 50 people in Maine who have passed away, and so I just want to make sure we recognize that many, many people, our friends, family members, people in our community have passed away, not just in Maine, but across the country. However, Michael, I do definitely share the concern you raise about the mental health implications around coronavirus. What I think it speaks to is a broader concern about the various ways in which coronavirus will echo across the state, mental health being just one of them. During these meetings, we've talked about my concerns around social isolation, loneliness, impacts on individuals grappling with substance use disorder, and as you note, depression, and the possibility of suicide being among them. We are concerned about that. Director Jessica Pollard of the Office of Behavioral Health and I have discussed this issue and this concern on numerous occasions. That office has taken separate and independent steps in conjunction with our broader work to try to anticipate what might be coming down the pike and make sure we offer services. And we've done so. We've made sure that our helplines are easily accessible, that the counselors who staff those helplines have training in how they might grapple and help people specifically contending with concerns around COVID-19. And we've taken it to make sure that healthcare workers have a line that they can call as well. We've also made sure, specific to substance use disorder, individuals who, for example, may have been receiving methadone treatment, still have a line to make sure they can get those treatments, not just in the normal day-to-day, but especially if they need to, for example, be placed in quarantine. Nevertheless, despite all those measures, our concern level remains high. And if you happen to be watching right now, and you are feeling like things are helpless, feeling as if there is no hope, and feeling as if you personally may not come out of this difficult time, please, please reach out for assistance. And know that there are people who are standing by to help you. And know that you are not alone. You need not go through the coronavirus situation by yourself. We will get through this. And there are people standing by to help us with that. Now, Michael, you also asked about the continuing rationale for keeping certain restrictions in place. And I think we need to look no further than what other states have already and countries have already started experiencing with respect to reopening. Starting several weeks ago, there started being reports published in the literature about the experience in places like Singapore and Hong Kong that started quickly moving to reopen and inevitably and invariably saw a significant spike in cases. Just yesterday, the state of Georgia reported over 1,000 cases of coronavirus in a single day. We also need look no further than pictures that came out of Orange County, California over the weekend of beaches crowded with folks no more than a couple of feet away from one another. So I think, Michael, although the curve has started to flatten, and although there are glimmers of sunshine that are out there, we are still very much in the thick of things, and the possibility, the risk of a resurgence in the number of cases is still very much with us. Now, although healthcare capacity is robust, and that's a good thing, that situation can still change. And so that's why Governor Mills believes that this staged reopening is the best way to mitigate any concern about a risk of a resurgence. And that's not based on speculation. It's based on the experiences of other countries that reopened and invariably saw that spike of cases. I'd like to turn next to Steve Betts over at the Courier-Gazette.
Thank you, Dr. Shaw. I know that you have repeatedly said, assume that the virus is in your community, even if there's no reports of one. I guess the question people have been asking me, why quarantine people from out of state who are coming into Maine for 14 days when we don't quarantine people? Say if someone from Bangor wants to drive to Rockland, there's not a quarantine. Just wondering what the rationale is behind that.
Sure. The basic rationale, so Steve asks about the rationale for quarantining individuals, asking individuals who are coming into Maine from other places to quarantine for 14 days, and why we don't do that for people who, say, might be wanting to go from Portland to Rockland or Portland to somewhere else. And the answer, Steve, comes down to the fact that the rate of disease in just about every other part of the country is significantly higher than what we have in Maine. Just to put those numbers in perspective a little bit, Massachusetts right now has over 62,000 cases of coronavirus. 62,000 cases for a state that only has 5 or 6 times as many people as the state of Maine. Again, Massachusetts has 62,000 cases and Maine has just over 1,000. So it really does come down to the differential risk that folks in other states have because of the steps that people in Maine have embraced, not despite them, but because of those steps and the way in which physical distancing has been embraced. The rate of cases in Maine is significantly lower than that of almost all of our neighbors. Certainly lower than states in northern New England, and probably lower than every other state in the Northeast. That's the rationale why others who are entering from other states, why the quarantine is recommended. Simply because the risk of someone from outside coming in is so much higher. I'm going to turn next to Kate Koff at the Ellsworth American.
Thank you, Dr. Shaw. So I appreciate the clarification regarding grocery shopping. We've got a lot of questions about that during quarantine, that is. And I understand the expectation that travelers, bring food for 14 days and that they arrange to have it delivered. But, obviously an expectation is different than a requirement. So I'm wondering, is that expectation legally enforceable? And do you expect, local law enforcement agencies to try and enforce it?
So Kate asks about the extent to which enforcement could occur for out-of-state visitors under the executive order. And the executive order is just that. It is an order from the state's chief executive. The extent to which it might be enforced is partly a function of local law enforcement as well as state-level law enforcement, all the way up to and including at the Attorney General's office. So the extent to which it might be enforced in any particular circumstance really does depend on that circumstance. So for specifics, Kate, I would probably refer you to local law enforcement as well as to the Attorney General's office and others to determine what their view is on to what extent they would enforce it in any situation where they don't believe it's being abided. But again, it is an executive order. I'd like to turn next to Amy Brown over at WERU.
Thank you, Dr. Shah. Will the public be, I have two questions. First, will the public be notified if the contact tracers start to notice any patterns in terms of the number of cases associated with particular types of businesses as more come on board? And then the second question is regarding the situation with a firefighter in Waldo County. Has universal testing been recommended for the other first responders that he was in contact with?
Sure. So Amy asks two questions related to contact tracing and how we go about notifying individuals with who have been in contact with a known case. And Amy, your first question relates to what extent will we notify the public if a particular business is implicated? And Amy, our practice thus far has been to do so, for example, with Tyson Foods. What the crux of the matter really comes down to what extent is the public at risk? Coronavirus is not the same as measles. In a situation involving measles, it's really important to know where someone was exposed because the virus can linger on a surface and still cause disease for many hours. But unless someone was a close contact of a known case, the mere fact that you happen to be in the same business with them a couple of days ago, say the same pet food store, doesn't necessarily mean that you are at risk. So our practice typically, because of that scientific difference, our practice is to notify close cases. Now, if someone reports to us that they were in the pet food store and they had 6 or 7 really close interactions with people and they can't remember who any of them were and they didn't know their names, then we would inform the public. But if every single person that the case came in contact with is someone we can get in touch with, then there's no general risk to the public. And that's the procedure that not just Maine CDC follows, but pretty much every other state health department in the country. Similarly, what's that?
Just to clarify, no, I'm asking about, like, say, dentist offices or hairstylists or something like that. If those kinds of businesses, there ends up being a lot of cases associated with particular kinds of businesses, it wouldn't be an outbreak per se, like at Tyson, but it would indicate that there are kinds of businesses where the social distancing adaptations aren't working very well.
So in those situations, and I know I can't speculate about what we would do in any particular situation, but in those situations, if we did notice a high number of cases associated with a particular business, our threshold is when there's an outbreak associated with it, we would move forward. One case can turn into no cases very quickly. So I want to make sure I'm answering your question properly, Amy. So you're asking if we detected an outbreak because of our contact tracing associated with, say, a particular hair salon, would we report that? And the answer is yes. If we detect an outbreak that is centered at a particular facility, then we would report it. If it's not centered at a particular facility, if it just happened to be a certain individual who traveled to multiple different places and happened to infect 2 or 3 or 4 people, then that's not something that we would report publicly. So it really does depend on the location of the outbreak itself. And if it did constitute an outbreak, whether it's a healthcare facility or any other kind of facility, that is something we would report. I would like to turn next to, who's next on the list? Admiral Don Kerrigan is next.
I've gotten a promotion. Thank you very much. A further very brief clarification on the Waldo County situation and fire departments. Has there been a recommendation or requirement at this point, to your knowledge, for members of some of those fire departments to self-quarantine, or is it too early for that? And then I've got a couple of business questions.
Sure. And Don, I just realized, Amy, I forgot to answer the second part of your question as well, which dovetails with Don's question. And so our investigation is underway. And this is a situation where any individual who happened to be a close contact of the confirmed case is someone for whom we would recommend quarantine. And if they develop symptoms, then we would move toward testing. That's the protocol that's endorsed by the US CDC, and that's the protocol that we follow here. And there's a number of reasons for that, but our protocol in these situations is that if someone was a close contact of a known case, then they're asked to be in quarantine, monitor for symptoms, and if symptoms develop, then we immediately move to test them. And so, Don, you asked about what numbers of people there are there. It is too early to tell what number of individual close contacts have been identified.
And then, Dr. Shaw, 2 of the questions regarding businesses. what's your confidence level that the businesses in phase one being allowed to reopen can do so safely and won't present a health risk? And then secondly, what further measures would it take to allow businesses general reopening in some of these northern rural counties that have had one, two, just a very small handful of cases so far?
Great. So Don's first question there is around our confidence level that businesses in phase one can reopen and do so in a manner that's safe without causing this dreaded resurgence in the number of cases. And Don, I think from a public health perspective, if a business is able to abide all of the items on the various checklists and make sure that they are able to discharge all of those obligations if they so choose to open up, then we've got a high degree of confidence that those businesses in phase one can do so in a manner that doesn't generate or lead to a concern about spread for disease. But the crux of it is whether they are able to make sure they get all of the items on the checklist and are able to discharge them faithfully. That really is what it comes down to. If they're not able to do each and every one of those things, I think any business that's contemplating reopening but is not able to do each of those things should reconsider whether now is the right time to reopen. Reopening is optional. It's not mandatory. Now, with respect to further measures for the regional approach, Don, I hear where you're coming from. I really do think that's to make sure I get you a good answer there. We're going to refer that question over to Commissioner Johnson and her team at DECD. They've been really thinking more about this regional approach and what conditions, if any, would be needed or needed to be satisfied in order for the state to move at different rates in different regions. So we'll have Robert send that question over to DECD so you can get an answer there, Don. Thank you. I'm going to turn now to Joe Lawler over at the Press Herald.
Hello?
Hey, Joe, go ahead.
Hi. Sorry about that. So I have two questions. The first one is, so I know Heather Johnson had been talking about perhaps doing something different in July and August for the 14-day quarantine for people coming from out of state to Maine. And if that were to be the case, if they were to eliminate that requirement and do something different, would you still have the prohibition on gatherings of over 50 people? Because it seems like if you have, thousands of people crowding into the old port and, Bar Harbor, et cetera, that, why would you have a 50-person gathering limit on other activities? And then my second question is just simply on the Tyson Foods outbreak. Can you say how many negative test results there have been, and have there been any deaths associated with the Tyson outbreak?
Got it. Thanks, Joe. I'm going to do those questions in reverse order. The first, Joe asks some additional questions about the Tyson Foods situation. And Joe, we do not yet, there have been no deaths associated with Tyson Foods at this time, and we do not yet have any of the test results back. And so at this time, I don't have a number of the negatives. Overall, their plan is to sample all of the employees, which numbers just over 400 individuals. And so we don't have any of those results back yet. And so hopefully we will over the coming days. And again, I can confirm there have been no deaths. Your first question is about the interplay between the 14-day quarantine and the 50-person limit, particularly as we get into the summer months, specifically July and August. And Joe, again, I'd have to chat with Commissioner Johnson about this specifically, and we're happy to refer the question to her. But given what we know about the likelihood of resurgence and what we've seen in other countries, indeed already in some other states, it seems unlikely that the 50-person limit would be lifted during that time period. But it really will depend on what's going on epidemiologically, not just in our state, but in adjoining states. But again, for the reasons that you note, that high density of crowd gatherings, especially if they involve people coming from higher incidence areas other states where there are more diseases that have been recorded, it seems like a difficult proposition to say we would remove that 50-person gathering limit. Anything can change in an outbreak, and things can change very quickly. But given what we know about transmission, it would be a high bar, a high threshold that we would have to satisfy in order to remove that limit at this time. But anything can change. I'm going to turn next to Caitlin Andrews over at the BDN.
Thank you, Dr. Shah. I have a couple questions about contact tracing. My first one is that you said the CDC plans to double its staff of contact tracers. What is the status of that hiring effort, and can you remind me of how many total contact tracers that will be?
Great. So Caitlin asks about our plans to ramp up contact tracing. And Caitlin, the first thing I want to note is that our plan to increase the number of contact tracers is a flexible one. It is largely determined by how the contours and the complexion of the outbreak changes. Right now, what we are seeing with respect to the outbreak in Maine is that it is largely homing in on congregate settings. We're seeing an increasing percentage of our cases, new cases, on a day-to-day basis being driven by outbreaks and continued outbreaks in long-term care facilities, densely populated workplaces, things of that nature. So that does alter our contact tracing a fair amount. As opposed to high numbers of new community cases, which is largely what we've seen in densely populated cities like Boston and New York. Right now, we've got close to about 30 individuals within Maine CDC who are solely focused on contact tracing in whole or in part. If the outbreak continues to grow in exponential terms, or if it resumes growing at an exponential rate, that's not what's happening now, but if that were to happen and we return to a situation of exponential growth with high numbers of community cases as well as high numbers of cases in congregate care settings. So if both of those things happen at once and we get back to exponential growth, we would look to expand the total number of contact tracers at Maine CDC to about 100 people. If we proceed along the path that we are on right now, which could change, our goal is to continue hiring up to a point where we are at about 60 total contact tracers. That would be the number that we believe we would need in order to keep tabs on the congregate care type outbreaks, whether those are at long-term care facilities, independent living facilities, or complicated workplaces. The reason I draw that distinction is that the type of contact tracers that you need for those types of outbreaks is actually different. For outbreaks at long-term care facilities, where there are multiple interactions with individuals who have medically vulnerable statuses, you actually need more of an epidemiology level training, an MPH, for example. For contact tracing that's done in the community level, where that requires a different type of contact tracer. It requires someone who can call cases and see who their household contacts are and provide advice on what those household contacts should do. So the nature of the plan is almost by definition flexible based on how we see the outbreak evolving. We're keeping our minds open because we want to make sure we hire the right people for those positions, depending on what we see evolving. I am going to turn now to Brad Rogers over at, oh yeah, go ahead.
Yeah, thank you. So to follow up on that, has the contact tracing staff discovered anything else about the spread of the coronavirus in Maine, such as the traveling salesperson that was mentioned a couple weeks ago? And how do we know if we're effectively tracing if testing doesn't become more widespread? And do you see those two things working hand in hand?
So they do. So Caitlin asks about the interplay between contact tracing and testing. And it's a good point that you raise. And allow me to here's how I think about it. Given where we are right now, without a vaccine, without a FDA-approved treatment quite yet, the steps that we've had to take thus far are somewhat blunt objects. It's a little bit like taking a sledgehammer to let the air out of a balloon. It gets the job done, but it's pretty aggressive and it can make a mess. And in many respects, it's much more than what's needed. That's the approach we've taken thus far. We've instituted these very, very aggressive measures around physical distancing, quarantine, in order to make sure we took the most aggressive stance given the severity of the illness. The intermediate step now, until we've got a vaccine, is to be more targeted. And that's what the test and trace idea is about. Contact tracing is just one part of the approach. The other piece is testing. Those two, in companionship with one another, as well as a third piece, which is isolation and quarantine, form a triangle. And that triangle is intended to block people out who have the disease to prevent them from spreading it to others. And that's the idea behind this second phase. It's predicated on three things: identifying folks, isolating them, and then investigating their contacts. One of the things that Maine has stood out on relative to other states is that the number of tests that we've done that have been positive is inching closer to what we've seen happen in South Korea. Maine's positivity rate is on the order of around 5 to 6%. Compared to other states where their positivity rate is 20 or 30%. Those other states are not testing enough people. Maine, however, based on our positivity rate, this is one of those things where the lower you are, the better you are, because it means that we're testing a wide array of people. That gives us confidence that the net that we're casting is broad and wide, and our positivity rate suggests that. Now, we need to do better still. We still need to get that positivity rate a lot closer to what we saw in South Korea. But we're starting at a much better place relative to Massachusetts, New York, other much more severely affected states. And so, Caitlin, that kind of answers your direct question about, well, how do we know we're identifying people? Well, in an outbreak, it's impossible, unfortunately, to identify everybody. But because of our very strong and low positivity rate, we've got good confidence that enough tests are being done, but we still recognize that more need to be done. I'm going to turn now to Brad Rogers over at WGME. Go ahead, Brad.
All right. Thank you, Dr. Shaw. A couple quick questions. Even if a business can abide by the checklist up in northern areas of the state, I would imagine you still might be cautious opening hotels and motels because that would bring in tourists into the state. And the other question I had is on the business in the restaurant in Newry, the brew pub in Newry, that's threatening or planning to open up this evening, and get your thoughts on that.
So Brad's first question is around the opening of hotels and motels, specifically in rural parts of the state, right, Brad? You're specifically asking about the rural areas of the state?
Correct. Yes.
Okay. Yeah.
Yes, correct.
Yeah. There's still a risk, as you note, because by definition, the tourists are not entirely from Maine. Although a sizable percentage of tourism is by Maine people within the state, we obviously all know that a sizable fraction is also from folks from out of state. And thus, when they go to visit rural areas, there is that risk that they could bring coronavirus with them. That's a risk. Now, we can't keep rural areas locked down forever. And so Commissioner Johnson, Commissioner Lambrou, folks from the Maine CDC have been talking about ways in which hotels, places of lodging, especially those in rural areas, might be able to open up safely. Nothing has been decided, to be clear, but there are discussions ongoing about ways in which establishments like that could open in a manner that still allows them to do business, but also keeps people safe, that makes sure that lounges and lobbies don't get too crowded, things of that nature. Those discussions are very much underway, Brad. Again, no decisions have been made, but once Commissioner Johnson and her team at DECD have made those decisions, they'll certainly be put out there. And then, Brad, you also asked about individuals who are moving toward reopening faster than what the guidelines and what the governor's plan outlines. I am aware of certain discussions that have been had around that. I've seen news reports about that, and all I can say is, just as I do with everyone in the state of Maine, I wish anyone who ventures out, and I wish everyone involved in those activities, nothing but the best of health. And the last question today goes to Megan from WMTW.
Thank you, Dr. Shah. I have a question as it relates to face coverings or masks, more than likely face coverings, as the public will now be wearing them when they venture out, when they go out. I remember sort of back when we first, started all of this, that face coverings really were something that protected people from you, not necessarily you from other people. So now that the face masks are sort of, or face coverings are in larger use, what sort of changed about the protection factor, and why is it being recommended as part of phase one? And also, can you talk about enforcement? I'm sure it's similar to Kate's question, that it relies on local law enforcement or law enforcement in general, but can you talk about how that will be enforced, if it will be at all?
Sure. So Megan's first question is around face coverings, and what do we know about their efficacy, and why now? And Megan, I want to start by just reemphasizing that face coverings, as they are required now, are not a substitute for physical distancing. They are in addition to, not in place of, physical distancing requirements. I also just want to underscore the point that you made and signal my agreement with it. The purpose of face coverings is to protect other people from you. As Governor Mills has noted, my face covering protects you from me, and your face covering protects me from you. Why now? Well, as we move toward reopening and the stages of reopening, we invariably know that there will be more folks outside. There will be more folks in different settings, whether that's at the hair salon or at the dog groomer or at a car dealership. There will be more additional individuals outside as opposed to strictly being inside. And so the concept behind it is that as the state moves to liberalize some of the rules, we also want to make sure we're simultaneously putting into place common sense measures to remind people to stay safe, because we know there will be more person-to-person interaction. Again, whether that's at the dog groomer, whether that's at the hair salon, or whether that's at a car dealership. So that's why the timing is now. But that being said, again, face coverings, although there are good data to suggest that the face covering does protect respiratory droplets from spreading, it is not a substitute from still maintaining that physical distance when you're in a location where physical distancing is possible. When you're not in that location where physical distancing is possible, the face covering is at least one way to mitigate the risk. All that being said, if you can continue to stay indoors, especially if you're older, especially if you're medically vulnerable, staying indoors right now and maintaining strict physical distancing remains the best vaccine that we have. So I'd like to thank everyone for joining today. Governor Mills, of course, had to get back to her office, but I do thank her for joining us and providing an update as well as a recap of where things stand. Thanks to our colleagues in the media for asking the questions, and thank you all for joining today. I look forward to chatting with everyone on Monday. Please, as always, have a good weekend. Please be kind and take care of one another. Thank you very much.
You have been watching the Daily Maine CDC briefing on the COVID-19 situation in our state. I'm Cindy Williams from News Center Maine. A quick recap for you. First off, looking at the numbers, there have been 2 additional deaths, a man in his 40s from Waldo County and a woman in her 80s from Cumberland County. There are also 28 new cases, 11 of them at Tyson Foods, which is one of the areas identified recently as an outbreak area. Governor Mills joined the news conference for just a short time to say that the state is beginning to reopen in some places, that for the first time the self-employed are able to apply for unemployment starting today. But she acknowledged that people are frustrated and that they are angry and that many of them think the pace of the reopening is too slow. She said there is no simple solution to any of this, but that she believes the majority of businesses in the state are committed to keeping Maine people safe and healthy. She is well aware, she says, of the crimp that this is placing on many Maine businesses, this slow, phased-in, 4-phase reopening plan, but that the debate on that plan will continue, that she feels that that is healthy. They're going to continue to talk about that, but of course they're also going to continue to prioritize keeping people safe. Dr. Shaw was asked how he felt about the Sunday River Brewing Company, which is opening today despite the governor's executive order to stay closed. We are seeing pictures of people lined up outside, standing very close to one another, not wearing face masks. Dr. Shaw said those people are taking a risk, but he says he wishes everyone there the best of health. That is going to do it for this News Center Maine update on the Maine CDC briefing. We're going to return you to regular.